Hello, today we'll deal with cardiovascular disease and COPD at the same time. Why is this important? COPD alone is hard enough to treat. But if you have cardiovascular disease also together, it's even harder and it's even worse for the patient. So these together are very, very common in the society. So let's look at the statistics. Which disease do you think is the leading cause of death in COPD patients? Cardiovascular disease. So here's the picture showing the whole cardiovascular system almost, except the lower part. As you see, we have heart, we have arteries, we have veins, and so on. And therefore, it's affecting the whole body. Okay, so if you have COPD, it's affecting the lung, which means that you don't get oxygen in your body. And if you have a cardiovascular disease together, it's affecting all of your organs actually. The main diseases included in cardiovascular disease, the main ones, are coronary artery disease, peripheral artery disease, and cerebrovascular disease. Of course, we have some smaller arteries also, but these are the main thing that we're dealing with. Coronary artery disease is very, very common. Here you see a picture of the artery. Coronary stands for the name, the heart artery of the disease. So heart artery is affected, therefore you call it coronary artery. Okay, peripheral artery disease, these are the peripheral arteries that you see on your lower legs or your upper arms and so on. So peripheral artery disease. And in both of these cases, we have a narrowing of the artery, which means that the blood supply is getting worse. So the organs cannot work properly because they don't get the supply of oxygen and nutrients and so on. And this can lead to very, very severe cases. For example, if you have a peripheral artery disease and your foot does not get any oxygen, the foot will die. It will be a necrosis. The same with the heart. If you have a heart disease and the heart is not getting oxygen, the heart muscle will die. And then it's called myocardial infarction and so on. Cerebrovascular disease is the same principle, but it's relating to the brain. So the brain will not get any supply of oxygen and nutrients, and therefore the brain will die. A part of the brain will die, and then you get the stroke, as we call it. So these are all related to cardiovascular disease. And as we said, the most common cause of death in COPD patients is cardiovascular disease, not COPD itself. So here we see myocardial infarction, we see stroke, and we see peripheral artery disease. How many times more common do you think cardiovascular disease is in patients with COPD? So if you take a population, we have patients without COPD, and we have those with COPD. How many times more common do you think is cardiovascular disease in patients with COPD? 5 times more common. Okay, so if you have a normal left side, there's a patient who has cardiovascular disease, and then on the right side, the patient has COPD, and he has a 5 times more risk of getting cardiovascular disease. You get that point? It's very, very severe. So please, we don't want COPD because then the risk of cardiovascular disease is 5 times higher. What is the most common cause of heart failure? Coronary artery disease. Of all the 3 things that we mentioned coronary artery disease, we mentioned peripheral artery disease, and cerebrovascular disease. The most common cause of heart failure is, of course, coronary artery disease. Okay, so this is blocked and nutrients don't get to the heart muscle and therefore it dies. What is the main risk factor for COPD and cardiovascular disease? What can you do to prevent this happening? Smoking. Stop smoking, please. I've dealt with another video explaining what you can do against smoking. Please stop smoking. Otherwise you get COPD and otherwise you get cardiovascular disease. So smoking does not only cause lung disease as COPD, it's also causing cardiovascular disease. People don't know this, okay? So it's causing both of these. And as we said, cardiovascular disease is stroke, coronary artery disease, and peripheral artery disease. So not only does it affect your brain, it affects your heart, it affects your lower legs, it affects actually all the organs that have a blood supply. And name one organ that don't have any blood supply at all. There exists no organ that can function without the nutrients and oxygen. So therefore, when you're smoking, you're actually killing your whole body because there exists cardiovascular system in your whole body. Which 2 symptoms are very common in both COPD and coronary artery disease? So a patient comes in and I need to distinguish, is this COPD now or is it coronary artery disease? And actually it's very hard. The 2 most common symptoms of having both of these is dyspnea and chest tightness. So if a patient complains about difficulty breathing. It can be cardiovascular disease and it can be COPD. If he complains of chest tightness, it can be coronary artery disease and it can be COPD. You need to distinguish this, and you will do it with some tests and some more physical examinations. So this is a summary telling me that the two symptoms that cardiovascular disorder, so coronary artery disease and COPD together can cause is dyspnea and chest tightness. Please be aware of this. Don't always think of lungs when the patient have chest tightness, or the opposite. If the patient complains about chest tightness, don't always assume it is coronary artery disease. It can be COPD, and also it can be both at the same time. Then you have some more difficulties distinguishing them because you have both in this patient. Diagnosis. What do we do? What type of tests do we do in COPD patients with dyspnea and chest tightness? We will do an ECG, troponin T lab values, NT-proBNP lab values. We'll do an echocardiogram, which is an ultrasound. We will make a X-ray chest radiograph, and we will make a dobutamine stress imaging. So it's a stress test instead of exercise test. We use medication here, which is called dobutamine stress imaging. So ECG, this is a simple thing. Please lay down, put some electrodes, and then we will get a paper showing the electrical activities on your heart. Troponin T, we take some blood and we check it in the lab, and we see if this is increased or not. Okay. NT-proBNP, the same thing. Take blood, check if it's high or not. Two diseases that can increase NT-proBNP is not only heart failure, it can be pulmonary hypertension. Remember this, not only heart failure. And therefore, the reason why we do all these tests is to exclude some diseases. And when we have all the facts laid down on our table, it's easier to distinguish diseases. Heart failure can be, as we said, together with COPD, and therefore we made this BNP level. And if we see that the BNP level is increased, then we can be kind of sure that this is heart failure. It is not due to COPD. To exclude COPD, we need to make another test called spirometry. And therefore, it's important that you do all types of tests related to both COPD and cardiovascular system. Pulmonary hypertension, this just means that the blood pressure in your pulmonary system, because you have blood pressure in your arms. For example, when you measure blood pressure, you measure it on your arm, but that's the systemic blood pressure. Here, we are dealing with the blood pressure connecting to your lungs. And therefore, if this is increased, then the blood cannot be pumped to your lungs as efficiently. And therefore, you see this buildup in your ventricles, in your heart. It's a buildup of fluid, a buildup of blood. Okay. Echocardiogram, very important to do. Why? We want to check if this patient has heart failure or not. And echocardiogram is the best device for checking heart failure, I would say. It's easy to do, of course, easy for a professional, I mean. It's not expensive, it is not any radiation and so on. So this is a very, very good test. You can see all kinds of information about the heart. So please make an echocardiogram for patients who have COPD, because it can be a heart failure also within this group. As we said, 5 times higher risk. Chest radiograph, here we will see a lot of pulmonary fluid, for example, a lot of fluid in the lungs if the patient has, for example, heart failure or another type of disease. And therefore, the chest X-ray is very good to exclude any infections, because we don't know why the patient has chest tightness, chest pain, or difficulty breathing. It can be a pneumonia also. So we really need to make a chest X-ray, I would say, for patients who have COPD and heart failure, or we assume that the patient has heart failure. So please do that. Dobutamine stress imaging, this is not really done all the time, okay? This is not something that you really must do, but it is advisable to also do, okay? We check the heart function actually with this test. We stress it with some dobutamine, and we don't use an exercise, because there's exercise stress imaging also, but here we stress the heart by dobutamine instead. And then we see if the heart function can keep up with this stress. If it cannot, then it's some kind of heart problem. And why do we perform this dobutamine stress imaging? As we said, we will use this instead of exercise stress testing because of limitations. Yeah, COPD patients cannot really breathe so good as normal people, so therefore I would not put them onto an exercise stress imaging. Okay, depending of course how severe the COPD is. Please note that if it's very mild, then you can do this exercise stress test. Good. So name a contraindication to vasodilator radionuclide myocardial perfusion imaging. This just sounds so fancy. I just needed to include that. No, there exists imaging tests, not only dobutamine stress imaging, but also vasodilator radionuclide with some radionuclides. We check the myocardial perfusion, and this is rarely done, okay? But with this test, it's really easy to see the function of the heart muscle cells. Really, really good to see them. But the contraindication is when we have a bronchoconstriction in COPD patients. So actually this test, if you want to check if the patient have heart disease and you are considering using this test, then please don't do it in COPD patients because we have a bronchoconstriction in these patients. So here we see a picture. Lower part, as you see, it's a constricted airway, and therefore the patient will not get so much oxygen as we know in COPD. So these are the tests. We said ECG, troponin T, BNP, echocardiogram, chest X-ray, and this dobutamine stress imaging. Please remember it in dyspnea and chest tightness. Dyspnea just means difficulty breathing. Okay, treatment, non-medical. We'll start with non-medical first. What non-medical? We have stop smoking. Okay, this is evident. Please stop smoking. Kick this cigarette out of your life. Vaccination. Please go and make vaccinations. Go and take this vaccination because you will not get influenza, you will not get pneumococcal infections, and so on. And these two things are very severe in patients with COPD. If you have COPD and you get a pneumonia, because of you get an influenza and you get a lot of bacteria in your lung, then you have serious problems. Because not only do your lungs functions really bad, but now we have a pneumonia, which you will need antibiotics and so on. You will not be able to breathe. So please make this vaccination thing a thing for you, okay? Don't be afraid of vaccinations, please, please. People who are against vaccinations don't know all the information. Or people who say that vaccinations are bad, either they know that it's not true, that it's bad, or they make a propaganda of this. And I don't want to go into politics now, but vaccination from a healthcare point of view is not only good, it's compulsory. It should be compulsory. It should be forced onto people. And not because the big pharma or because of some big companies want to make some money. That is complete bullshit. Of course, companies want to make money. Of course, every company wants to make money. But do you really think that big pharma would give you something that would be harmful for you, and that all countries in the world and all research in the world would agree on this just because of one or two companies having money or wanting money? Do you really think this? Do you really don't trust your government in such a way, or not just your government, all other countries' government? You really think that vaccinations are harmful and it is given to people anyway because they make a lot of money? Please, if you want to make a lot of money, you don't go into vaccination business, okay? There are other possible business models that don't harm people and you get a lot of money. So forget this argument. And the reason why I'm emphasizing this, I could continue with my presentation now, but the reason why I'm emphasizing this is because I see many children die in the hospital because of mothers not letting their children get vaccinations. And this fear that they have killed their own children. Okay? And that's pretty sad. Or what do you think? That's harmful. That's harmful. So go, please, take vaccinations because it's very good for you. So name some more non-medical treatment options. We have long-term oxygen therapy, LTOT. It's abbreviated as LTOT, okay? And we will discuss that in another video. This just means that you get oxygen therapy in your house. So you have a bottle of oxygen nearby you, and you get that through this bottle. And then you have a more chance to do your things, do your daily activities. And this is the reason why I'm grouping it into non-medical. It's almost a medical, but the reason why I'm grouping it to non-medical is because it is not a medication itself. It's oxygen, it's air, okay? It's just that it's coming in a higher concentration into your body. Then we have, of course, the more severe cases having non-invasive positive pressure ventilation. This is usually not given for all patients. The patients who require this type, these are very severe, okay? NPPV, non-invasive positive pressure ventilation, okay? So these are the four things that you can do non-medically. Stop smoking, give vaccinations, and please, this long-term oxygen therapy, and if very severe, then non-invasive ventilation. So how do we treat COPD in patients with cardiovascular disease? This comes as a question now, because we know how to treat COPD alone, we know how to treat cardiovascular disease alone, but what happens when we have these together at the same time? Then it will be the same. Thank God, okay? The same, because there are a lot of theories here and there that, no, you should do this and you should do that. No, actually, there are too much research showing both sides, that it's good to do something and it's bad to do something, that the conclusion is do the same therapy for COPD, do the same therapy for cardiovascular disease. In this case, there will be no confusion. The same as without cardiovascular disease. That's the answer here. So you treat COPD as we talked about in my other videos about stable COPD patients. Okay, so that's the same, regardless of having COPD and cardiovascular disease alone or at the same time. How do we treat now cardiovascular disease in patients with COPD? This is almost the same thing, but the order of the question is a little bit changed. Here I ask, how do we treat COPD in patients with cardiovascular disease? Now I ask, how do we treat cardiovascular disease in patients with COPD? And that is also the same, but except please don't give non-selective beta blockers, because that could lead to a bronchoconstriction, so a narrowing of your airways. That's the only thing I would highlight here. So please, in a patient on the left side with COPD, please don't give non-selective beta blockers to these patients when you treat his cardiovascular disease. Okay, if we're not allowed to use non-selective beta blockers, then what should we use? That's the question. Cardioselective beta blockers, atenolol or metoprolol, because these will not constrict the bronchi, the lung bronchi, so the airways. It's cardioselective. It's selective for heart, okay? And therefore, it is very good to give atenolol or metoprolol. So, quick summary. Let's check some quick summary. The disease that is the leading cause of death in COPD patients is what? Cardiovascular disease. The main types of cardiovascular disease: coronary artery disease, peripheral artery disease, and cerebrovascular disease. Here's a picture of coronary artery disease. Here's a picture of peripheral artery disease and cerebrovascular disease. All together, remember, main diseases that's causing death in COPD patients is something related to the vascular system. How many times more common is cardiovascular disease in patients with COPD? 5 times more common. What is the most common cause of heart failure? Coronary artery disease. Which is the main risk factor for COPD? Smoking. And it's for both of them. Which 2 symptoms are very common in both COPD and coronary artery disease? Dyspnea and chest tightness. Dyspnea and chest tightness. So you see this picture summary. I always try to reinforce the information as many times as possible, because then you will remember it. Of course, you can check this video many times, but I want to tell you this as many times as possible because it will just stick to your mind. Rote memorization, I would call it. So the test that should be done now in COPD patients with chest tightness and dyspnea is ECG, troponin T, NT-proBNP, echocardiogram, chest radiograph, dobutamine and stress imaging. ECG, troponin T, NT-proBNP, and NT-proBNP have two diseases: heart failure, pulmonary hypertension. That is increasing these levels. Remember, not only heart failure, also pulmonary hypertension. We have echocardiogram, very cheap, very good device to check heart failure. Chest radiograph, you will see many things here like fluid and infections and so on. Dobutamine stress imaging used rather than using exercise stress imaging because the COPD patients have a lot of problems breathing, and therefore it's better to use a medication instead. And the contraindication to using this advanced, fancy myocardial perfusion imaging is because of bronchoconstriction. Okay, and these are the tests: ECG, troponin T, BNP, echocardiogram, chest X-ray, and dobutamine stress imaging. The non-medical treatment options is stop smoking, give vaccinations, long-term oxygen therapy, and non-invasive positive pressure ventilation. So please stop smoking, give vaccinations, give long-term oxygen therapy, and non-invasive positive pressure ventilation in severe cases. Now, we treat COPD in patients with cardiovascular the same, and we treat the cardiovascular disease in patients with COPD the same, except don't give non-selective beta blockers. Instead, give cardioselective beta blockers like atenolol or metoprolol. And now I will reinforce memory again, and I want to ask some questions. And these are all the same questions that we did until now, but I want you to answer them. So please, I will ask the questions, you will answer it. Stop the video if you cannot answer it quickly, and then move on if you can. Questions for you, and it's practice time. Which disease is the leading cause of death in COPD patients? Which are the main diseases included in cardiovascular disease? How many times more common is cardiovascular disease in patients with COPD? What is the most common cause of heart failure? Which is the main risk factor for COPD and cardiovascular disease? Which two symptoms are very common in both COPD and coronary artery disease? Which tests should be done in COPD patients with dyspnea and chest tightness? I want many here. I'm waiting. I want many. Name two diseases causing elevated NT-proBNP level. Why do we perform a dobutamine stress imaging instead of an exercise stress testing? Name a contraindication to this fancy vasodilator radionuclide myocardial perfusion imaging. Name some non-medical treatment options. Please name 4. How do we treat COPD in patients with cardiovascular disease? How do we treat cardiovascular disease in patients with COPD? If we are not allowed to use non-selective beta blockers, then what should we use? And that was it, okay? If you could answer all these questions perfectly, then you know it 100%. If not, please go back and check the part that explained that. And I thank you very much for listening, and keep up your work. Have a nice day. Thank you. Bye-bye.